guys. I'm Ryan Branson, John Peters, and Ryan Waldo. Hello. So we know what we would like to get out of tonight, what our objectives are for you guys, but I just would like to go around the room and ask everybody kind of why they're here and what they'd like to get out of it. So who'd like to start?
I'm Carol, and I have pain in my hips sometimes and down this side of my leg, and I know it's due to an old bike injury, but it erupts every once in a while. So what I can do to control it, and basically, what can I do for inflammation beyond taking pills? Are there any foods I should have in my diet that help with inflammation, or what else?
Okay.
So inflammation.
Okay. And do us a favor. At the bottom of that health history form, you see the shoulder girdle on there. Just write your question down at the bottom, and if we don't address it during the presentation, feel free to ask us at the very end. So, thank you.
I'm Sarah. I've got a bad back, and I got shots. I've been dealing with that from just an injury, and I did have a couple injections. That was very helpful, but then it seems like oddly, all of a sudden I started having all these other issues, which I guess maybe, I have no idea why that is. It sounds like maybe because one thing got fixed, another thing got went bad, but I've been going to physical therapist for that, and going to chiropractor next door here, and check out, see if I could figure out a way to get working out and losing weight, because I know that would definitely help my back, and I'm curious to find out what I'm doing.
Great. Good, thanks.
Hi, my name is Pat, and I have neck, shoulder, cervical spine issues. Kind of goes down my arm and into my hand, and so that's what I need to address.
Okay.
I'm Joan, and I have a right hip pain, and I really had a bad summer where I was, after golf, I lifted my bag out of the back end of the car, and must have twisted wrong, so I really hurt my low back, and then that made the hip worse. So I'm just trying to find something that will help those issues.
Thanks.
I'm Julie.
Hi, Julie.
I'm listening, but I was like, okay, I have fibromyalgia really bad, and have had previous success with myofascial release and foam rollers, and learned a lot. So when I saw your thing, I was like, okay, I want to continue that knowledge and keep on that path and see what else I can pick up.
Great.
My name is Karen, and I'm older, and I have an injury this summer, an ACL sprain. So we're going to try to get some strength back into that.
Hi, Jean.
Hi, guys.
Jean.
I'm here 3 days a week, and when I first came in, I couldn't bend. My hamstrings were tight, I ran, and so I've been working 3 days a week for 1 year and a half to get back to what I'm able to do, because my hamstrings were so tight. There was a time when I couldn't run, and these guys use some of what they're going to tell you tonight, but I think they'll be much more than I can use. So I'm glad they're doing it.
Thanks. Well, as stated on your PowerPoint, this lecture is not intended to diagnose or act as any sort of treatment. Really what it does is there's a lot of stuff out there that we found is really beneficial for our clients and patients, and so we'd like to pass this information to you. So introductions, again, I'm Ryan Branson. I own Renegade Personal Training and Fitness. I was with Lifetime Fitness previously before I left in 2008. For about 6 years, I was at Woodbury Lifetime, and then after college transferred to the Egan facility, where eventually I was Brian's assistant personal training manager and trainer. So I love what I do, and everybody here. Thanks for coming.
Brian Waldo. I'm the only one with gray hair.
Yeah,
So far.
so far.
But, I've been in health and fitness for over 20 years. Started off in more of a clinical setting in a chiropractic physical therapy environment for about 8 years. And my main role there, back in those times, they didn't really have physical therapy assistants certified and so forth. So anyway, back in that time, they would hire people like myself, who I was trained as an exercise specialist or exercise physiologist, and I would work with some of the, the therapeutic exercise and things like that at the clinic. So that was primarily what I did there, and then moved to the cities around 2000 and worked with Lifetime Fitness for close to 9 years and managed a couple different training departments for Lifetime Fitness. And I guess going on 2 or 3 years ago, left there, I started doing some teaching at Corrective Technical College in their exercise and sports science department, and then came here to train Ryan. So that's kind of my story, and I'm sticking to it.
This is John Peters. Nice to meet you, who I am just meeting now. I've been doing this officially for about 10 years, mostly with Lifetime before I decided to come over here and do a little bit more my own thing. I wasn't involved in the personal training or health field right out of college. I was actually in radio for about 2 years, but I'd always been involved in sports, athletics, working out and so forth, and I found that sitting all day was not what I was interested in doing for work, so I started doing this. So over the course of working for Lifetime, worked as a trainer, worked in management, worked in running the boot camp program and so on and so forth, and then some of my more specific areas that I've gotten into is the corrective field, also with a certification that Brian has, which is muscle activation techniques. We'll talk more about that later. And also, kettlebell instructor certification, which is something that we don't necessarily use with Corrective right out of the gate, but it's an option that you have of going to later, and it's a fun thing to do. I've been doing it, again, for about 10 years, and I just really enjoy helping people improve their lives overall, not just typically lose weight, but just whatever your goals happens to be. And obviously in respect to this, it's more move better, feel better, let's not hurt so much. That's me.
Okay. So today's objectives, we want to give you a better understanding on corrective strategies and corrective approaches. To have you provoke thoughts on how you're exercising versus how you should be exercising. And experience a functional movement screen that will show you which is kind of the foundation and the starts of a corrective exercise program. We'll get to that in a little bit. And lastly, to answer questions about corrective exercise that you might have. So the game plan, if you haven't done so already, go ahead and fill out that health history form, along with any questions you might have that will until the end. We're going to discuss the effects of pain and injury on the neuromuscular system. Again, different approaches of corrective exercise, MAT versus typical exercise, self-myofascial release with foam rolling, corrective stretching programs, and how to get started if you're interested.
So I'm going to get a little bit into just talking, what are some of the causes of pain. As we went around the room tonight, I just heard a lot of different stories, anything from strained ACLs to, so some of them revolve around injuries, and for some of you it's more around a chronic condition or situation that you're dealing with or have been dealing with over a period of years, or an old injury that maybe you had a long time ago that just seems to keep creeping back into your life. So learning how to deal with those situations becomes important, and really the root for a lot of people's pain is inflammation, simply. Okay, so you see a list on this slide presentation as to some of the sources ultimately for inflammation, such as repetitive stress, direct injury to like the knee or the hip. If you were to get in a bicycle accident, or mind me asking how you hurt your knee?
Fell out of the back end of my husband's pickup.
Well, hey, there you go. Things happen, right? Yeah. So I mean, things like that occur, and then what happens, or what do you do to follow up and try to get stronger, or if we have a weakness that's created because of that, how do you deal with it? Okay. So ultimately, if we're left with a source of chronic inflammation in a muscle or in a tendon or in a joint, or maybe even in and around your nervous system, we have dysfunction that's present within your body. And that cycle can kind of go up and down. So how many of you kind of have good days and bad days with your pain? Just about everybody. And I've had pretty serious back pain before in the past, so I can honestly tell you that I know what it's like to be in pain. On more than one occasion, John can attest to this.
Yeah.
So
He's a
John
legit,
fixes
so.
me up when I'm in trouble. So thank you, John.
You do vice versa. So we'll talk about all my jumps later.
But some of the other things you see on here are things like overtraining. So overtraining kind of points to exercising maybe too much, or maybe it's too much exercise in combination with your activities of daily living. So things that you do around the house, gardening, mowing the lawn, and, housework and things like that in combination with what you're doing for exercise. So sometimes if we're doing too much in total and our body can't get past this point of overcoming whatever inflammation you have or source of inflammation that you have, it becomes an uphill battle relative to ultimately getting rid of the dysfunction that is part of your pain. Okay? So a lot of what we're going to talk about tonight is the fact that that inflammation causes a dysfunction in the muscle and ultimately causes a weakness within certain muscles in your body. Now, everybody's situation is a little bit different, okay? So we can't generalize too much with respect to that. We're not physical therapists, so we're not here to necessarily diagnose you with a specific condition, but however, as personal trainers, what we can do is assess how your body moves and how your muscles function, and we can work with that, okay? And I think to a large degree, generally we have pretty good success with that, okay? So ultimately what happens is you have inflammation, say, within a given muscle, okay? And to kind of get to the long and short of why you might have weaknesses within your muscles, if we have two different types of muscle cells within a given muscle, so if I take my bicep here, if I were to kind of just lop it off, and we could look at it from the end, and we could see two different kinds of muscle cells. One type of muscle cell actually has, if you could envision it like a rubber band going through the middle of it, okay? And the other type of cell does not have that rubber band. So every muscle has a certain percentage of rubber band muscles, and it has a certain percentage of muscles that don't have that rubber band. Now that rubber band is called the muscle spindle. What it is, it's ultimately a sensor in your body that picks up on length-tension relationships within your body. So it's constantly sending feedback, that rubber band muscle is sending feedback back to your brain and your nervous system that's telling it how long or short that muscle is at any given time, how much tension is there at any given time, okay? Now, what happens with inflammation, either acute or chronic, is that it gets in and around that area of that little rubber band or muscle spindle within those muscle fibers, and it actually impacts or affects the feedback that your brain gets. So you might think that your muscles are actually working and contracting to their best, your brain does. You're convinced that you're doing everything you can to work that bicep muscle. But ultimately, what's happening is your muscle is really only partially contracting. So it's contracting enough to move your arm or to lift a weight if you're strength training, but it may not actually be capable of fully contracting. And there's ways of assessing that with some of the techniques that we're going to talk about tonight. Okay? So that's really what we're talking about with inflammation, is that it impacts ultimately this relationship between your muscles and your brain. And so we're going to keep diving in on that a little bit as we go. But the longer that stuff goes on, so the next slide talks a little bit about the risks of poor movement, posture, and pain. The longer this kind of thing goes on, the more you're at risk for degenerative changes in joints in your body. So the longer we have dysfunction around a knee or a hip or things like that, the more insult those joints take over time, because we have unstable joints, and we have unstable systems within the body. It can lead to lack of performance. So I know some people like to run and say some road races, 5K, 10K, or a marathon, or you might be into some other type of competitive event. It can hold back your performance ultimately. Okay. The other thing is a lack of progress in physical goals. So just about all of you, I think, when you went around the room, you're kind of involved in and around fitness at some level, or you're attempting to be. Okay. And would it be fair to say that just about everybody feels a little hindered in what you're able to do because of your situation? Okay. So ultimately, if you could fix that, what would that mean for you? Would that be meaningful? If you could move on and do certain things in your life that you can't do now, would that be meaningful? Okay. So, with that, do you have any questions at all so far? So kind of sense this whole inflammation thing and how that kind of impacts your body. Okay. So ultimately, the way we work as trainers is that we work with a concept or a strategy called corrective exercise. Corrective exercise really is a basis for how we design your exercise programs and what kind of recommendations we would give you. So instead of just saying you should do cardio 5 days a week in this heart rate range, and you should do this, you should stretch, all these muscles, and by the way, you should do at least one exercise for every body part, and do 3 sets of 12 of everything. Well, probably all of you know that at this point. Okay. So what this does is it gives us a specific strategy for your body, for your situation, for your specific weaknesses and or tightnesses to work forward with that. So the 2 different approaches are using an overheaded squat for assessment and or muscle activation technique. And these 2 guys are going to talk more about that. I believe Ryan is up first, and he's going to talk a little bit about overhead squat.
Overhead squat. I was trying to think of something smart to say.
You'll think of it later. Right. You want me to right away? Or?
No, so overhead squat, as Brian mentioned, it's an assessment tool that trainers can use to discover inefficiencies or efficiencies through movement. We're looking for dynamic flexibility, core strength, balance, and overall neuromuscular control. So with the information we gain from this, it helps us develop a corrective program. What do we need to foam roll? What do we need to stretch? And then what do we need to strengthen? So with that, John's going to demonstrate an overhead squat from 2 different views. We look from the front and then we look from the side. And you can notice right away, John's got some inefficiencies going on. His feet turned out and his knees kind of knock-knee go in due to tightness all along the inside of the body. And obviously he's exaggerating for our purposes here.
This is when we do see a lot of it. A lot of the knees crashing.
And these are the big common 2 from the front. And weakness on the outside of the leg. So from the side, so one of the first things you notice is his arms drop forward due to tight chest, tight lats, and a weak upper to mid back. Secondly, you notice that he's got a little bit of forward lean going on from his trunk due to tight hip flexors and weak glutes. This could tell us a number of things about what he does for a living. A lot of times it will indicate that he sits for a living, or he might do a lot of overhead work, such as construction or carpentry. So those are some of the things that we look for. Now go ahead and show them what a normal overhead squat looks like. Minimal inefficiencies.
Relatively normal. Still got some tight spots here. You might still be able to pick out some inefficiencies.
So even though he's trying real hard to keep everything in line,
It's not totally perfect.
and from the side here, his arms are falling forward, probably from the old shoulder injury, right, boxing?
Yeah, there's lots of junk going on.
Right. So that's the overhead squat assessments. If you feel like something like this can help you, make sure you ask us after the seminar. But with that, are you up?
Yeah.
Okay.
All right. So I'm gonna chat with you a little about muscle activation techniques. So, has anybody heard of that ever? Okay. Does anybody know who the Denver Broncos are? Okay. So the guy who came up with this whole technique, his name is Greg Roscoff. We're not going to go on history or whatever, but he's dealt with works with Denver Broncos and then some other professional sports teams, helping their athletes enhance their performance, limit injuries, things like that. I'll just read the quote real quickly. MAT is a systematic approach for evaluating muscular imbalances that contribute to injury, impeded recovery, and compromised performance. So what that means in English is that, as my instructor when I'm doing this technique said, is that really what we're doing is preparing the body to exercise. Meaning, we just jump right into an aggressive exercise program without looking at where some of the, as I like to say, hitches in your giddy-up are. We're going to make some of those problems worse, and that's going to limit your overall ability to perform, reach your goals, that can lead to injury, and so forth. Specifically what MAT does is, yes, we look at muscle tightness, we'll talk about that in respect to, say, stretching and so forth, but then that it's secondary to muscle weakness. So really what we're looking at is what areas and muscle fibers, what muscles specifically, are weak, are dormant, are underactive. And how can we wake those guys up? Because we can stretch them all day long, but if that's not the issue, if the issue is that they're weak and that they're underactive, we need to activate them and wake them up so the body can move, how it was intended. So specifically what we're looking at is asymmetries left to right. So for instance, I'm going to exaggerate this here, and we'll get Brian on the table in a second, but if we're checking shoulder flexion, for instance, so if I can go, let's say, and again, I'll exaggerate here, if I can go this far with this shoulder, and only this far here with my shoulder flexion, that's obviously a big difference. And eventually what's going to happen is that if we don't address that, either in your exercise program or in your daily life, you're probably going to have an injury, or at the very least, it's going to impede your body's ability to perform. Whether it's a sport or whether it's something like gardening, it doesn't matter. So the more we even out those imbalances, the more the body is going to work how it's intended to move. So again, you can perform at your best and limit injuries and limit pain. Specifically, we do, as needed, 3 different assessments. One is for the upper extremity, for the shoulders, one is for the trunk and spine, and one is for the lower extremity. So as needed, we might do all 3, or we might do just one, depending upon what your individual situation is. So we're going to get Brian here on the table, and just in case you were wondering, he is not going to be faking for effect, because we're both a little jacked up.
There's plenty of problems.
Yeah. Mine are, oh yeah, so let's see here. So you know that we can all relate to you in some of your injuries and so forth. I've got a reconstructed ACL, tendinitis. So I'm still able to do a lot of things, but I have to be mindful of those things. So, or of those particular issues that I have. So what we start with the muscle activation techniques first is a range of motion evaluation left to right, and see what are our biggest asymmetries. Now there's a number of different tests or positions that we go through, but we're going to do this a little bit of an abbreviated version, so we don't bore you guys to death, because there's like 23 of these for the lower body. So we'll go through like 3 or 4 here. So one, we're going to have Brian here straighten this knee and externally rotate this leg, and then he's going to raise that left leg up as high as he can. So you can feel free to make fun of any limitations that you have here. So you can see, about yay angle. All right, relax. Now go ahead and we'll have him do that on the other side. We'll see how tight he is today. We just did some of the stuff the other day. Okay, so better than the other day actually. But can you guys see a difference there? And stretch your, you did too much of this the other day. You should look worse. All right, now we'll check another one. And feel free to stand up and get a little bit closer here. That's okay? We're just going to check this one. So it's kind of,
stand back.
yeah, actually. I mean, if you want to stay seated in your chair, that's fine. Just get a little more interactive here. So gonna check his internal external rotation at the hip here with the hip flex 90 and the knee flex 90. So he's gonna swing this guy in. So I'm looking at this from an overhead view to see the angle. And then I'll check it here. Now if it's anything, go ahead. So this one's so if it's anything like it was the other day, that straight leg raise with the external rotation is going to be the worst one. But we're going to give it a look-see here. Just to give you an idea of what we look at. Now he's going to go ahead and swing it to the outside or internally rotating here. And then same thing over here. So I got like two to choose from. Okay, so we'll go with the first one just so, because it's easier to see from your angle. What my instructor used to say is we're looking for elephants, not mice. So we're going to have a lot of little hitches, but we're looking for the big ones, the ones that are causing you the most pain, discomfort, aggravation. So it was this leg that we weren't able to raise up as high. So now we're going to do what's called a muscle test. So Brian's going to get in that same position here. So what I'm going to do is I'm going to push down with about 15 to 20 pounds of force, and he's going to resist me. Okay, ready? Resist. Okay, so not as spongy as it was the other day. It would have just dropped like that, but he still wasn't able to resist. So now we're going to treat that with isometrics here. So go ahead and bring it up. All right, and just as we're doing this, the range is going to start to improve. So I'm going to hold it here with this hand, and then give him some slight resistance here. Now what we're doing with the isometric is instead of me doing just yanking him into place, he's going to have to actively push and activate those muscle fibers. That's what's going to help wake him up. So go ahead. So we'll start at 10% again. Now typically what we'll do is for this an 8 count, we'll go like 10%, 25%, 50%, 75%, and then full effort. If you're really aggravated in a particular body part, go ahead and relax. You may have to keep your exertion level a little bit less. So wait about 10 seconds here, and then we'll do it again. So how this is going to be different again, more of a passive stretch, for instance. Again, so push a little harder this time, about 25%. And again, he's actively doing this, and I'm resisting. So he's doing the majority of the work. So we're going to get better brain-body connection, better blood flow, and better just retention of this muscle activation. Okay, relax. Now we're just going to do 2 more. So we'll do one at 50% and one at 100%, and then you should be able to see some difference there. On 5 more seconds. Okay. So it's already going up a little bit higher. All right. Keep that knee straight. Yeah. All right. Ready? Again. 50%. Now, can any of you guys see this range increasing so far, or not so much?
Yeah.
Okay. Cool. 3, 2, 1, relax. All right, we'll do 1 more at full effort. Typically we do about 8 repetitions, but again, we don't want to bore the heck out of you guys, so we're doing an abbreviated version here. All right, 1 more time. All right, now this time we're going to go full effort. All right, ready? Begin. Just crank on that there. Yeah, breathing is very important. Breathing good, not breathing bad. 3, 2, 1. So relax, and then we'll just check that range of motion again here in about 5 more seconds. So typically, just by moving differently than you may have moved before, you're going to start to feel some things open up. All right, go ahead and just bring that up. Now, normally we muscle test this.
Oh.
Okay. All right. So normally we muscle test it again, but just for expediency, we'll just take it off the range of motion. So, all right. Cool. So, do you guys see the difference there? All right. Does anybody have any questions on that?
How long does it last?
You know, it depends.
Have to do it again?
No. Well, how it usually works is we start out, and it's going to be a long answer, but I will answer your question. Starting out, we do that evaluation and go and we find those big points and start working on them. And it may last a couple of days. It may last a week. It may be longer. What usually happens is as we start waking that stuff up, each time that we do it, we don't have to do as many of them, and it's retained longer. So we get to a point where we may be doing good, solid 25–50% of a session with you working on this type of stuff. and then we get to a point where it's more of a bit of a maintenance thing, where maybe we just do it occasionally for 5 or 10 minutes at the beginning, and we have a better idea of how you're feeling and so forth. So as we get better, it lasts longer. You can probably answer that. Yeah.
I'm just gonna add 2 quick things. One would be, it is definitely a learned response, so it's kind of like, you know, when you're first learning how to throw a ball, it's really awkward. You might throw the ball over here and over there until finally you figure out how to get that ball where you want it to go. So it is a learning process that your nervous system goes through as well, because the longer you're disconnected from that muscle or its ability to contract that muscle, you need more repetitions to get it to stick. Okay. And then the final thing is, if you're doing activities within your everyday life or within your workouts that are either continuing to increase inflammation or cause, in other words, if it's too difficult for you to do, to the point where your movements are forcing you through ranges of motion where these weaknesses are present in your body, that's going to give you more pain, it's going to give you more inflammation over time. Okay, so it's going to take you backwards instead of forwards. So that's where we try to be as specific as we can with giving you recommendations with what to do outside of doing these corrective exercises and what kind of things maybe you should avoid for a short period of time. Okay, so that's
Pretty much on MAT, so you can roll right forward.
I just have a quick question.
Yeah.
Is that just for like your limbs that works on, or do you have a way of making it work for other muscles that aren't so maybe
The
easy to get to?
extremities?
Yeah, is it just for the extremities?
No, it's the shoulder or the upper body, lower body, and then the trunk and spine. So the trunk and spine is often, some of the most challenging stuff is obviously your vertebrae and so
Yeah.
forth. But yeah, absolutely. So the centerpiece of the core is something to focus on a lot in training, because you can't be very strong here if you don't have strength here. So the short answer is yes. And then some of the ones we'll look at for trunk and spine, as you hear my colleagues crack here, is your ability to rotate side to side, bend, and things like that. So yeah, we definitely address more of the center area.
Any other questions?
Yeah, after you do this, Brian, do you then give people exercises to go home on doing? I mean, I know there's certain things I do, but not to this degree.
Yeah, absolutely. The isometrics are something that can be reproduced at home, so that's commonly what we do. We'll work with you here, but then teach you how to reproduce some of the same things at home, so that you're capable of reproducing the repetitions that you need to make improvements over time. So the repetition of the exercise is important, not just so typical strength training that you might do 2-3 days a week is common recommendation for a total body workout, for example. With MAT work, you need to work on it every day. It's not just a couple times a week kind of thing. So it's a mental exercise as much as it is a physical one. So yeah, great question.
And we actually give each other isometric homework and stuff to do when we're working on each other. And whether we do it every day or not, it's, sometimes we can do a little better.
Yeah, we have
Yeah.
issues too. So anyway, the long and the short of the whole thing is that does flexibility in and of itself ultimately allow you to move more effectively? And the answer would be no. Does it ultimately necessarily reduce your pain? The answer would be no. Really, what will help you with more efficient motion, what will reduce stress on your joints, your back, pelvis, your spine, is actually strength and stability. So without strength and stability, if we have weakness, you're going to have tightness in your body. Okay? So, and that tightness will be recurrent. So if you're the type of person who's maybe been through therapy and you've done different types of exercises to try and help your situation, and you feel better right after exercise, and you feel better right after you stretch. I used to work in a back pain clinic, and actually before I was exposed to muscle activation work, you know, I hear it all the time where the stretches made me feel better, made people feel better. But 2-3 hours later, some of their tightness starts creeping back in, or maybe even sooner, okay? And what I've come to realize over the years of doing this stuff and actually being involved with muscle activation technique and some of the movement screens is that what's happening is we weren't getting specific enough with where you're weak. And if we get more specific with where you're weak and strengthen those areas, there's a ripple effect there that allows for you to then, those tight muscles that are compensating for you because of your weakness, now start to let down and loosen up. And the muscles that are weak start to do the work that they're supposed to do. So now all your muscles are kind of sharing in the work that they're supposed to be doing, instead of this side of the room is pushing some of the work over this side of the room. Okay? You know, it used to be thought that use of like stability balls and balance exercises and things like that were the way to go when it came to strengthening some of these situations. And the reality of it is you might get better balancing on a ball. You might get better balancing on a disc or something like that. But the reality of it is your body is still using a compensation pattern to do that. So what you're doing is you're actually strengthening your compensation. You're not strengthening the weakness, because your body will always go and utilize its strongest aspects. Okay? So by backing up a little bit, taking your program, paring it down, doing things that are a little more simple, okay, you can actually take big strides forward in terms of your health, your fitness, and performance. So, any questions? Welcome, by the way.
Thanks.
I'm Brian.
Brian?
Yep.
I'm Fanny. Nice to meet you.
Massage therapist.
Yes.
I've heard much.
Oh.
Julie and Fanny are both massage therapists, which I know some of you know, both of them. So thanks for coming and bringing some of your
Yeah,
people
thanks.
here. Appreciate that. So next, I believe we are up for a little discussion on active versus passive. Sorry.
That's what you're up. Okay, all right, we'll move back and forth here. Okay, so active versus passive. So we'll try to get a little discussion going. You had, give me some ways that you guys can think of that you would be, say, passively working on an injury or dysfunction. Anybody?
Just being mindful of the way I'm standing at work, where I'm standing, not, my knees locked. This is advice from a physical therapist, that's just kind of an easy thing to do, but
Okay.
I don't know if that's
That's
your mind, but.
Well, no, that's fine. That's actually a little more active that you're actively doing.
Oh.
So you're ahead of the game.
Oh,
So that's not a wrong answer.
okay.
That's fine. So basically, we're looking at as far as passive versus active, and it is a little bit of a tougher question. Passive is more so that you're being acted upon. So, like for instance, massage, chiropractic, and things like that. And those are often places that we send our people and we recommend, and that we go ourselves as well. And those are great tools. But in addition to that, you want to take a little bit more of an active role in your, say, therapy or improving or what have you. Because, when you're getting a massage, you're being adjusted, or say if one of us is just doing a passive stretch where you're moving you into place, that definitely has a lot of benefit, but you don't have to think about it as much. So what we're wanting to emphasize as far as the exercise piece, and as far as say things like activation exercises and isometric exercises and so forth, is we're working more of that brain-body connection and working more of that blood flow and getting you in the habit of, say, taking an active role in what it is that you're trying to do. So you have people that are working on you, but you also have some things that you're actively doing. Not only are you going to remember things more, Again, increase your blood flow with these certain movements, but it also gives you more of a proactive or control feeling of I am actively doing some things for me to make these improvements. Now, does that make sense or not really? Okay, all right, cool. So, and again, how we're doing that is looking at the length and tightness relationship, stretch what's tight, activate what's weak or dormant, and so forth, and then move on to developing your core strength, your base, and so forth. It's getting to be a little bit of a review. So basically what we're looking to do then is start to work in more of an integrated fashion. And again, how we take that active role with the corrective exercise piece is it's individualized to you, and there's some stuff that we're doing along with you. But again, there's also those exercises that you are executing, say like those isometrics and so forth, on your own. And really what we're trying to do, or what we're doing rather, I hate the word try, I hate qualifiers, is to get your body working as more of that, yeah, it's fine, you can laugh at me. What we're doing is working your body more of that unit. So your muscles are working with your joints, your movement is going to flow more efficiently and naturally, you're not going to feel so hitchy with everything, and then ultimately, we're going to minimize your risk of injury so that you can move better and feel better. Whether you're somebody who wants to run a 5K, or you're somebody who just wants to feel better with some of your more everyday activities, things like playing with your kids, grandkids, gardening, and stuff like that. What that's going to do is provide an overall strong support system. Again, feel good, move better, minimize injury, and so forth, no matter what your goals are. And that was a little abbreviated, but I want to leave more time for the interactive stuff. And Ryan's going to go into the self-myofascial release or foam roll. So I'll wrap.
So I had some note cards because I've got an attention span of like a dog, squirrel and I'll chase it. So foam rolling. Before we get to the benefits and the applications of foam rolling, let me give you a quick background on what's called your kinetic chain. Kinetic chain consists of three different systems. Your articular system, which is your joints, your soft tissue system, which is your tendons, ligaments, muscle tissue, and your fascia. And what fascia is just the connective tissue that binds muscles into separate groups. And then lastly, your neural system, which is your central nervous system and your nerves. These three systems, they all work together to produce movement. And if one or more of those segments of the system of the kinetic chain aren't functioning efficiently, well then we've got breakdown. Other parts of that kinetic chain lead to compensations and increased inflammation, increased scar tissue, and eventually increase the chances of injury. So what foam rolling does is helps eliminate that scar tissue. And scar tissue, we can think of it as like cooked spaghetti. Before we cook spaghetti, that the noodles, they're in the package or they're in the box and they're smooth and they really slide against each other in that box. But once you cook it and throw it in the strainer, that the noodles, they're bound, they're intertwined, and yeah, just really bound together. So that's how scar tissue works with the fascia and the soft tissue of your muscles. And so foam rolling is going to help decrease the pressure and the tension within that scar tissue because scar tissue has absolutely zero elasticity to it. And so not only does it help decrease pressure and tension, but it also helps increase circulation to the injured muscle group, helping to increase oxygen and nutrition to that muscle, which in turn can stimulate. It has a healing effect. The other thing that I forgot to mention with foam rolling is it's almost like a warm-up to stretching. So just like we go and lift weights or we're going to go for a long run, we should be warming up slowly, Gene, on the treadmill for about 5 minutes beforehand to elevate body temperature. That's what foam rolling is going to do for you before stretching. So it doesn't make you more flexible, but it warms you up so you have a better opportunity to stretch. So at this time, John's going to grab a foam roller, and we're going to put you in the figure 4 position and have you roll out your piriformis. Piriformis is right in the hip. So Yep, 3 or 4 position, he's gonna roll on one side. Common practice with foam rolling is about 1 to 2 minutes each side. Now, if pain is reported on that muscle, you wanna stop rolling and hold that spot for a very minimum of 30 seconds. What we're trying to do is, we wanna relax that muscle. So this is more of a neuromuscular thing than it is
It's not that bad.
stretching.
This isn't one of my worst points.
So 1 to 2 minutes aside, and what John's doing right now, he's drawing in his abdominal wall. You're gonna hear us say abs tight quite a bit, and that's gonna help stabilize the pelvic floor muscles. Go and switch sides. You can do this 1 to 2 times daily before your workout. You can do it later on in the day in front of the TV if you're just sitting at home.
How long did you say, 2 minutes?
1 to 2 minutes. And then if you're on a painful spot, for a minimum of 30 seconds on that spot. Just don't roll over it and roll back and
Exercise is
forth.
1 to 2 minutes.
You can actually, it reverses that inhibiting effect. If you roll back and forth over it versus just staying on it, you can make it a lot tighter.
You gotta wait for the, I always tell my folks, wait for the pressure to feel like it releases about 2/3, 3/4 of the way, and then just work your way down.
Has anybody else ever rolled in the past? 1, 2, 3, 4, 5, 6. So what's it feel like when you do it?
It's painful, but it's like a good hurt.
It's a good hurt.
It stops the muscle spasm. I mean, it stops from getting worse and worse and worse. So at least it deactivates it, and then you can let it release.
You notice the inhibiting effect.
Right.
Right.
Mhm.
So, next one, we're going to have John do his IT band. This one's going to run from your hip down to your knee. And this is a real good one, especially if we have any runners in here. You oftentimes hear about runner's knee. Well, your IT band contributes to that. And the problem with the IT band is there's almost 0% elasticity to it. It's really, really difficult to stretch. You really can't. So, foam rolling is one of the few ways to get it.
Yep.
Yep. So with this one, in general, we're going to find 3 or 4 spots between the origin of the muscle and the insertion of the muscle. And lastly, I should say, never want to roll on a joint itself.
But he works out all the time, and he still has these hot spots or whatever there.
Trainers are kind of like doctors, and a lot of times we're not quite so good at following our own advice. So we'd rather do squats and deadlifts and other stuff than do some of the corrective work, which isn't as fun or exciting, but is just as necessary. And then quite often, because no person is 100% efficient with or perfect with their movement, if you got somebody who's like us, pretty active, or say even a way higher level like a professional athlete, their little compensations are going to get exacerbated just by the volume of work that they do. So you got guys like Adrian Peterson, who is a crazy physical specimen, and yet he's doing a lot of this type of stuff, I guarantee you, and sitting in the hot tub and so forth, because his body is just exposed to that much work. So whether you're somebody who just is moderately active and wants to feel better, or someone who's working out 2-3 hours a day, you're going to have some issues. So it's universal.
It's just say not to go over the joint or.
Never roll on the joint directly, right? And the last thing that I should mention about these, they come in a variety of shapes, sizes. You get the different myofascial tools. You don't have to stick with just a foam roller. But they also come in different densities. So this one is not nearly as dense as the darker one there. So if you're a beginner to rolling and you're first looking at buying a foam roller, which will go for $15 to $35, depending on where you get it from, and most times you find them on sale. We'd recommend starting off with a little bit less dense of a roller. Performbetter.com has them 50% off right now.
Fall better?
Yep, Perform Better.
Oh, perform better.
Right, so other tools you could use would be a medicine ball or a
Tennis ball.
well, tennis ball. What's the
Stick.
stick? But yeah, that'll work too.
Okay.
What's
Actually, rolling pin will work good for
the lacrosse balls?
Yep, there's lacrosse balls, there's the Yamba system, which is a series of different density balls that you can use.
Right.
So
So yeah, Ryan, nope, that's it.
Okay.
So ultimately, we use the foam rollers to improve mobility, right? That's what we're kind of talking about, decrease tension. So it's the opposite of some isometric stuff that John did with me on the tape. John was trying to activate some muscles that were weak, and we were just using the foam roller here to try and deactivate areas that have hypertonicity or too much tension. So we can use them together as a system to try and bring balance back into your body. Now sometimes you've got to take things yet to another level. And true gurus, I guess you could say, of muscle activation technique would say that you should never stretch. Stretching is worthless because until you fix your weakness, your tightness will always be there. Okay?
Say that again, sorry.
Until you fix your weakness, your tightness will always be there. It will always come back, no matter what you do. No matter if you stretch, if you foam roll, you get massage, go to chiropractic care. Doesn't matter what you do. If you haven't figured out where your weaknesses are, those patterns will either recur in your body because it's a neuromuscular thing. Unless you're using some other intervention to stop that tension. Okay? So that's what they say. They say we have to find those weak spots and address that. But sometimes there's more to it than that. Okay? And that's where sometimes you may need the help of a physical therapist. You might need the help of a massage therapist to work through scar tissue and things like that in your body when you have injuries. Okay? Or relieving just in general tension that maybe this helps to a degree, but you still have tension in your body that is hindering you. So things like massage therapy can be helpful with that. All right. But what can also be helpful is corrective stretching. Okay, so you have another sheet. We're coming down the home stretch here, I promise. I see some tired eyes out there. Now, the difference being here is that we would incorporate the corrective stretching ultimately in areas where you have this chronic adaptation. So there's a difference between if you have an acute injury and you might have just a little neuromuscular tension that's there because of that, or let's say you've had chronic pain that's been there for 10 years. It's been bugging you for a long time, and that's caused chronic changes in how you move for 10 years. Well, depending on what you've been doing to deal with that, for some people, what that does is that changes how your body functions. It changes your posture, and it changes your ligaments, changes the length of various soft tissues in your body. Ultimately, most people tend to have this kind of a forward posture kind of thing going on. So a lot of times what corrective stretching does is it focuses on areas of your body where you may have a pattern. And what we do is there's actually a system with the overhead squat where, depending on how you're moving and depending on your posture, we recommend certain stretches. Now, these stretches are just examples, okay? Are these ones that you should all be doing? Not necessarily, but they are common ones that we use with a lot of people because of common postural, we call them syndromes, or we call them symptoms, okay, that tend to be present in most people that have pain. And or just you may be someone who doesn't have pain all the time, but you have poor posture, which leads to occasional pain. Okay. So when do we do this? When do you think the best time to stretch is? After?
Before.
Before? Okay. Let's get a show of hands. After?
Before and after.
I've heard both, yeah.
Before and after. Before and after. Okay.
After you warmed up?
After you're warmed up. Well, in reality, you all can be right. your individual situation. The research does show us that stretching before exercise does not necessarily do anything in terms of injury prevention. Nothing. Okay? Research shows us that. So what we know is that a good dynamic warm-up before activity, where you increase your body temperature slowly, actually does more to decrease your injury while you're exercising or while you're working around the house or whatever it is that you're doing. Okay? That'll do more for you than stretching, typically. However, if you have scar tissue that you're dealing with, or an injury, a surgery, or an accident that you were in, you may benefit from stretching before and after. Okay, so we try to loosen that scar tissue up a little bit beforehand, best we can. We do all the techniques that we've talked about already to try and improve the efficiency of how your body moves. Then we go exercise or work or whatever it is that we're doing. Then at the end, ultimately is the best time to stretch, right before your body starts to cool down. Because when you do that, your body has more of a tendency to maintain that lengthened state as it cools down. So it's like you took a rubber band out of the freezer and you tried to stretch it. What do you think would happen? It would break. And if we warmed it up to room temperature, it stretches, right? So now if we took that rubber band and held it inside the freezer or put it in a stretched position in the freezer, closed it, shut the door, froze it, what would happen? It's going to stay like that, right? So similarly with your body, that's kind of what happens. Not quite like that, but pretty close, okay? So the more we stretch at the end, the more that those tissues will stay in a more lengthened state, okay? And that scar tissue will remodel in a more effective way and things of that nature, helping you improve again your movement, allowing you that opportunity to get stronger and build on that each day, okay? So it's a process. And I guess the answer is not simple necessarily. What it boils down to is really evaluating your own situation and trying to apply some of these principles into your situation in the most logical manner that makes sense for you, okay? So it may not be a blanket answer. However, what you may want to do is you may want to just sit back and think about, what am I doing right now with my exercise? Am I already incorporating some of this stuff or not? Have you ever thought about how you're exercising in this particular way or not? And then consider whether or not something like this might be helpful. Now with the corrective stretches, you see here, there's probably 2 or 3 that I think are the most common ones that I use. Okay, the middle top, right here, the hip flexor stretch is a good one. And ultimately, the way that works, if we were to do a hip flexor stretch, you're down in this position now. Many of you have probably stretched your quads or your hip flexors like this before, right? You ever do a stretch kind of like this, where we drop in and try and stretch the front of your legs or your hips a little bit? Now, a lot of times with corrective stretches, what's really important is your body position. So if you look from the side, if I do this traditional kind of track, hip flexor stretch type move right here, or old football player stretch right here, right? Okay? Yeah, I'm feeling a stretch in the front of my thigh, but it's not relative to what my pelvis is doing. So with the corrective approach, what we do is we teach you to stabilize your pelvis by using your glutes and your abs. You activate these 2 muscle groups, keep your pelvis still, and then move into the stretch until I feel a deep stretch right in here. So right now, I've got a stretch from my knee all the way up deep inside my hip, okay? And then we work with a little bit of lengthening up in here with your arm and a little bit of rotation, so that we're starting to work in all 3 planes of movement, because your body oftentimes doesn't just move straight move side to side, we move in rotation. In fact, our body moves more, we have more function in our body in rotation, pronation, supination, than we do any other. So the transverse plane, or this rotational kind of plane like this, is very important in our body. Okay. So what we do with the corrective stretches is really work with you on body position and specifically making sure that you're not just feeling a stretch in my pec, but that the rest of your body is lined up in the best position possible while you're doing that stretch. Okay. So, any questions about corrective stretching?
I have a quick question. Maybe because I wasn't here when you made. How do you increase your body temperature before stretching?
Well, what I usually recommend if I have clients at home that say, for example, they are going to stretch in the evening, but they're not necessarily going to work out in the evening, I just recommend that they do some light activities around the house. So even if you're just, you know, picking up around the house, maybe vacuum a little bit if that's allowable in your house, things of that nature. You know, just move around a little bit, pick up some things. If your house is like mine, which right now I have 2 teenagers in my house, I can put a sweat on, try to pick up after those 2. So, you know, but light activity, or you know, even just go for a walk. If your house is perfectly clean, you have no need to do any of that. You know, get out, go for a walk, and it should be at least 5 to 10 minutes probably. So a couple blocks, go around a couple blocks, come back in the house, and go ahead and stretch. Or if you have steps in your house and it doesn't hurt for you to go up and down the steps, you use something as simple as just going up and down out of the basement 2 or 3 times. Things like just something to get your heart rate elevated and start shunting blood out to your muscles in your body. So. Okay. John.
All right, so we're about wrapping it up here. And then we'll definitely have time for some questions. So if you're following along, obviously we've been paraphrasing a little bit on the sheets, but this is where we're at right here. So, and this concept help you? Yes, of course. Otherwise, you wouldn't be here. We wouldn't have invited you here. So, how do we go about it? How does it work? So that's actually the next page, and we'll just go over briefly the protocol. So first is the evaluation piece, or this is where I like to say we sit down and we figure out, or start to figure out, what's your deal? So before we even get to the overhead squat or an MAT assessment or other specific things that we do, we sit down and we go over with you, first off, what are your goals? If you're not sure what your goals are, we're going to figure those out and set some specific goals as far as things you want to achieve as far as increasing range of motion, decreasing in pain, certain activities you want to be able to do again, and so forth. We'll also go over a history of what injuries or other medical issues that you've been dealing with, whether it be a hip, a shoulder, or a combination of those, so that before we get to the actual physical evaluation piece, we have a good idea of what we're looking for. An overall exercise history just to determine what have you done in the past and what's worked and what may not have worked, so we can avoid those things that haven't worked or exercise strategies and maximize some things that may have worked for you in the past. And then we'll do the overhead squat, and then if needed, one or more of the muscle activation techniques assessments or any other particular physical assessments that we determine are necessary. Find those big hitches in your giddy up and start to address those. That's where we get into the corrective exercise training, and that's where we're looking at those, as my old instructor said, elephants and not mice. Elephants, not mice. So the big boys, the big problems, and addressing those, whether it be a lot of rolling here because that IT band is just very aggravated with scar tissue, or for instance, a common one, our glutes are inactive, so we're going to do some isolation stuff, for instance, some bridges to activate those glutes. So this is where we're being more specific and isolated with foam rolling or stretching to settle down what's overactive, and then isometric exercise and so forth to start strengthening and waking up what may be dormant or underactive. And then next, once we get you as evened out as possible, or at least see some good progress there, then we're ready to move into the stabilization training, and that's where we move more from isolated to integrated. Meaning instead of focusing on specific muscles or areas, we're working the body in more of a comprehensive or combined fashion. So before, they were doing more of those bridges or some more isolated work, and now we're ready to do something, again, that's a little integrated, like a lunge to a knee raise, where we're working multiple muscles and multiple body parts. Or if we want to get more fun, lunge with a pair of dumbbells, curl, press. So we really focus on training the body as a unit and getting it to move and function better as a unit, both in here, but also so those activities will translate into things you do outside of it. Typically from there, then we move into somewhat more of the traditional exercises or phases of training where we're focusing on muscular development, just increasing muscular strength, increasing muscular size, which is going to help you with your metabolism, calorie burning, and so forth. And really from there, sky's the limit. So advanced activities that's pretty broad. So it can be no more challenging phase of training, like a power phase, where we're doing explosive movements or something, or it could be, say, for instance, sports specific. If you're somebody who likes to golf, and once you've gotten your body up to speed in a good overall strength fashion, we're ready to focus maybe more on, say, rotational activities and core strength and so forth, or whatever phase may be appropriate. And then as far as the length of time, it really varies from person to person. Those first two phases can take anywhere a month, 2 months, maybe longer. It really just depends on you and how your body's progressing and responding. And it's very much an ever-changing and exploratory process. We're always finding out and learning more about what you've got going on as we progress through the different exercises and phases, and then making adaptations based off of that. Ideally, within the first week or 2 weeks, you start to feel better. Maybe even just a little bit as far as noticing a little bit more loose in your overall movement, which maybe isn't the best word, but just a little more, say, relaxed, better posture, and so forth. And then as far as a real significant change, you say 2 to 3 months, but again, it really depends on you and just your individual situation as far as how fast we're progressing and so forth. And as far as just overall wrapping up, ideally you're walking away here with some tools as far as foam rolling and so forth that you're able to utilize on your own. But the next step that you can take would be to do that initial evaluation piece, which is where you're sitting down, getting your exercise history, doing those evaluations, and then determining a specific path forward for you. So and some of you guys are already working out here, but for those of you who aren't, if you are interested in doing that, I would just ask that you put your info on there. That way, if we don't have as much time to speak with you individually this evening, we can get back to you within the day and set up a time for that. So again, that's a complimentary invite that we want to do for each of you. And again, that's something where we do the sit-down piece, we do the evaluation piece, we may just do the overhead squat, or as an in-depth of an assessment as we need to get. And then we figure things out from there. And then depending on how much time you all have, we can talk more about that individually or set some of those up this evening at least. We've got your info there. And then lastly, questions of any sort. Questions?
What do you know about if the body is not moving freely and working optimally, it also affects cognitive health? Have you read anything about that? I read recently, but I can't quote the reference, that it affects memory loss and your brain doesn't work when the rest of your body isn't, working.
That might be a question for the professor.
Yeah, there's a lot of research out there relative to brain health and exercise in general, just movements. We know that when people are more active, that generally their thoughts are more fluid. So in other words, we think more clearly, things of that nature. And so when we have pain, generally what goes along with that is either only short bursts of activity followed by long bursts of pain, which means long bursts of inactivity and frustration,
and depression,
Depression.
and so on and so forth. So you have this cascade of events, both mentally and physically, in your body that definitely occurs, you know. So, yeah, there's definitely a connection between our mental health and our physical well-being in both directions. So there's times too where we maybe have mental stress that we're dealing with that affects our physical being. So it can go the other way also.
Yeah, speaking from my own personal experience and just knowing my personality, I'm very type A, so exercise is my mental dumping ground. And I tell a lot of my people that, and I think it works the same way for them as well, even if they're a little more laid back and relaxed than I am. For most of us, we have a pretty solid sedentary component to our daily life, job, whatever. Even us who are trainers, we do admin work, we're calling, we're on the computer, we're researching something, what have you. So when you exercise, either moderately or vigorously, you're releasing those, for lack of a better phrase, happy endorphins. So you feel energized afterwards, you feel better, and at least for me personally, it helps me to focus a lot more. If I'm sitting in front of that stupid laptop for more than 2 or 3 hours, these guys can attest to that, I start getting a little jittery. So the more physical activity I engage in right now, yeah, I'm just trying to be generous for myself. The more physical activity, regular physical activity that I feel that you engage in, the more productive and just relaxed you're going to be in just all areas of your life. Other question?
Anything else?